Okay, hi, Shirvin, is that how you pronounce your name?
Yeah, it's Shirvin.
Nice to meet you. So before we start our interview, I was just wondering, what do you know about our Address Teen Stress project?
hmm I briefly looked at your Instagram page and I see that you guys are exactly as it sounds, doing work to help with teen stress. And you've been interviewing different clinicians to learn about their perspectives and just promoting that and raising awareness.
Yeah, you're exactly right. So it's a mental health initiative started by some high school teen girls in order to address teen stress, which is something that does not get talked about a lot. So one of our series, Beyond the Brain, we talk to like psychologists and therapists in order to get a different kind of perspective. So yeah.
Awesome. Good job, guys. Good job doing that.
Thank you. So, to start us off, would you like to tell us a little bit about yourself and your background, please?
Yeah, of course. So my name is Shirvin. I have my master's degree in counseling psychology, and I practice out of Vancouver, Canada. So my certificate or license is a registered clinical counselor, which is something you can get in our province. And from there, I've been doing a lot of work in substance use, addictions, chronic pain, and I typically, in my own practice, help with individuals who have anxiety and different types of mental health struggles. On a personal level, I was raised in a very traditional Chinese family, and we had different values and growing up. So, growing up in a very traditional family in a Western society, there's a lot of conflict, a lot of things that were confusing for me in terms of values and beliefs. So that also led me to want to be a therapist because there aren't a lot of Asian therapists out there. And yeah, I guess some fun facts. Living in Vancouver means we have a lot of access to the outdoors. So I play a lot of sports like volleyball, ultimate. And yeah, I really enjoy my time outside when I'm not working.
So what got you into clinical counseling?
Sorry, can you say that again?
So got you into clinical counseling? Like what was your
Mhm.
interest towards it?
After I graduated from my bachelor's degree, which I did in science, I was looking for work somewhere in healthcare. I knew I didn't want to be a nurse or a doctor. It's because with those roles, there's just so much science involved that I wasn't really keen to continue learning in that degree. So I stumbled upon a substance use and addiction center, and they used a lot of evidence based approaches and collaborative care, meaning clients would be working with a doctor, they'd be working with a therapist, and they would have multiple people on their team to help with their substance use. So my job there, I was the program manager. I basically made sure the program was running. I did a lot of the administration, logistics, and I got to work very closely with the therapists, and I did all the intakes and exit kind of interviews with the clients. So seeing the roles that the therapists had to help them make the change after from the beginning until the end of the program and how empowering it is for people, I thought that was very inspiring and it led me to become a therapist.
That's really cool. So we have seen that you are the founder and host of your own podcast called Fundamentally Human. So what was the
Mhm.
purpose of the initiation to start that podcast and how has that created an impact?
Mhm. I started it probably 2.5 years ago. And at first, it was really because I felt like I was learning a lot of different things from school, my master's degree from work that I just wanted to be able to share. And when I look back at all the episodes, I have about 50 out now. It's almost like a online journal for me of all the learning that I've done, and I get to interview and talk to people on the podcasts, and you really, I think, learn from other people's experiences. And it's something that I really cherish because sure, you can Google all these things, all these symptoms, all these whatever treatments, but I think the learning of and experience really comes from people's stories, people's struggles, people's growth. So the podcast is a great way for me to not only build on my skills as a therapist, but for me to share everything that I've been learning with everyone else. And I think because on Spotify, you get the Spotify Wrapped each year, so the summary. And last year, I was telling me that I was in the top 20% of podcasts. So that was really cool to see, because even with my Instagram page and my podcast, I don't sell anything on any of those. I just do it because there's just so much that I feel like I learn as a therapist. So I like being able to share it.
That's really cool. We really appreciate you sharing all this like valuable information with us, because I agree, like Google and like any internet, you can always search up things, but like listening to people's experiences one-on-one is really valuable. So we saw on your website that you run your own practice called Lee Counseling and Associates with your friend Jennifer. So how did you guys come to the result of founding the service, and what was the step-by-step process behind it?
Yeah. Well, Jennifer and I, luckily, we both share the same last name, Lee, so that made it a lot easier. But we have been working together for a while at the Substance Use Center, and then after I became a therapist, we knew that we wanted to continue working together. And as a therapist, being able to have your own private practice, it comes with its pros and cons. The biggest pro being you make all of your money back. And whereas when you work for another private practice, you have to pay a commission. It's either 40% or 35% you get back. And that pays for things like an office, marketing, whatever tools they use, because they'll get you the clients. Whereas when you have your own practice, you do a bit of more admin work. You pay a small overhead depending on if you rent a space or if you have other online tools you use for your sessions, and you have to find your own clients. So, there are different pros and cons that comes with each of them. But yeah, Jennifer and I, we have our own practice together, and it's been great.
Among your clients, what do you think is the number one issue that you have helped treat or improve?
Hmm. I think usually what comes up the most, no matter what age or gender, is having these thoughts that can be very catastrophic, that can be automatic and negative. So being able to reframe that and helping people stop from spiraling are things that come up the most.
So going back to your practice, I had another question. So
Yeah.
what would you say was the most difficult aspect of getting your own practice started? Like, was it getting the clients or finding a space or a platform?
With our practice, we do it virtually, and it worked out because of COVID as well. So a lot of people actually prefer doing things virtually now. It's more comfortable, and they don't have to leave their home for a session or take time off of work. I guess the biggest difficulty is probably getting clients, because you have to do all that marketing yourself.
So, what would you say, like, how do you think stress affects a teenager's body?
I think being a teenager now is probably really, really hard compared to when I was a teenager. I didn't have access to things like, I don't really use it anymore on a personal level, but things like Snapchat and Instagram, I didn't have that till I was university. Whereas I know that kids or teens are starting using it when they were in elementary school. TikTok was not a thing until I had my master's. So, like I can imagine the attention span has changed for teenagers, what they're interested in, access to so much more information, the way they compare themselves. I used to have a book where I wrote my friends' phone numbers, and that's how I would call them. I didn't have a lot of, smartphones. I didn't have data on my phone until I was at least 2021. Whereas, now when you're 7, you might have an iPhone. So there's a lot of change to access to technology. In some ways, it's better, and in some ways, it's more harmful. And I think that definitely does a lot to a teenager's body, because when you're feeling stress, when you're feeling anxious, when you're feeling, upset or angry, your body is changing with it.
That's
So on
sorry.
your counseling website, you mentioned that growing up in a traditional Asian family, it made you feel restricted in expressing your feelings, and you felt that having that emotion was a sign of weakness. So how did you overcome that cogitation?
Hmm. I mean, it's been many, many years of having tough conversations with my family, helping them come face to face with their emotions, teaching them how to express it, teaching them that just because something didn't go right doesn't mean they have to, suck it up. They are allowed to have feelings, they're allowed to express them, and you can communicate them in healthy ways.
And do you think that your background of being an Asian American has some kind of input into your perspective on mental health as a topic?
Hmm. I'm Asian Canadian. I was born and raised in Canada, but there aren't too many Asian therapists out there. And I think being able to understand, the term, and have lived through generational or trauma, from because in Asian families, you have a lot. There's so I'm not sure if you're familiar with the terms collectivist culture and individualist cultures. And what that means is, in a collectivist type of environment or family or culture, you are essentially, you work together for the family, for kind of the greater good. And that's very typical in many Asian families. So you're doing everything for face, you're doing everything for your family reputation, and it's always about the bigger group. Whereas in America and Canada and Western societies, it's much more individualistic. So you do things for yourself. And there are pros and cons to both of them. One includes more of you do it for the family, and one is more you think about yourself. And, to answer that question, it's bringing awareness, just like how you are with teen and teen stress, that there are different values that come up in different settings and different families and cultures.
So, what are some tips that you have for teens that are dealing with anxiety?
Hmm. I think the first one is knowing that you don't have to go through it alone. If you're having feelings, if you're upset, you're nervous, it can be helpful to talk to someone, whether it's a friend or, most importantly, I would say a trusted adult. It can be very helpful to release some of those emotions and some of that stress. And then the other one is, I think this one probably comes up a lot, but really just limiting that screen time. Are you noticing that you're on TikTok a lot, you're on Instagram a lot, and you're scrolling and comparing with these models, these friends, because, you don't really have as much awareness or understanding of how the perfect picture is maybe made, or what goes behind the scenes for some of these videos that seem realistic but are pretty much fake and made up. So being able to just limit some of that screen time, I think, will really help free the teenagers from that very potential toxic environment.
What are some misconceptions that you think a lot of people have on therapists or just therapy in general?
I think the way maybe sometimes social media or movies or TV shows portray therapists is we kind of just sit there, you cry, maybe we talk about your childhood, and then time's up. But what they don't know is that there are a lot of different modalities, different interventions that each therapist might practice. For example, the most common one is CBT, cognitive behavioral therapy. And that one really looks at the way you're thinking and, examining and comparing that to how you're feeling. Are your thoughts true? How can we reframe that so that it's either neutral or positive? And then there are other types of therapy modalities that you might have seen out there. I practice Adlerian therapy, so it's kind of looking at your life as a whole, examine different parts of your childhood. There's things like motivational interviewing. We're trained in specific ways to ask questions that are meant to help motivate you so that you come up with your own goals and conclusions. Somatic therapy, art therapy, play therapy. There are so many different types of therapies that people might not be aware of. And there's a reason why we need to have a master's degree, because we are professionally and academically trained to support someone.
And adding on to that, what do you think are some misconceptions people have on mental health?
I think one of them is your normal needs to be happy. That's your baseline. And I don't think that's the case, because the moment you start to believe that and you start preaching that to other people, what happens is there's that expectation that you need to be a certain way, which can be really harmful. I think what's more helpful is to think about your normal or your baseline as, average. When you're maybe, you don't have to be super excited. It's just when you're kind of at this level, and you can go anywhere along the spectrum, and those are all okay things to feel. It's okay and normal to be angry when someone's done something to upset you. You don't have to suck it up. You don't have to try to be okay with it. You can have healthy, tough conversations with yourself, with other people, and that is all okay.
Okay, so lastly, what advice would you give to someone that's struggling with their mental health, or like your message to our Address Teen Stress audience?
I think that at the end of the day, we are all trying our best to do what we can with whatever circumstances we have, and being able to know that you don't have to be alone in all of this is something I want to be able to remind teenagers. It's not embarrassing to have feelings. It's not embarrassing to have low moments, and that other people are likely going through different types of challenges and struggles and even wins themselves. So being able to share that with each other and be that there for each other, I think, is the best thing we can do as a whole.
All right, thank you so much for speaking about mental health and clinical counseling and everything. I think this is a very knowledgeable, information-taking interview, and we really appreciate it a lot. Vedika, do you have any words to say?
No, just that I really think it's cool that you chose to step out of your comfort zone and try to support other our Asian community and become a therapist. And I just really think it's amazing what you do. So thank you.
I think it's great what you guys are doing as well. It's a tough world out there as a teenager. Like I said earlier, I can't imagine what it would be like to be a teenager now. So it's great that you guys have taken this initiative to support others.
Thank
It's a
you.
good job. That's why when I saw your message, I was like, of course, it's like you guys are putting the work in. So whatever I can do to support, I'm honored.
Thank you.
Thank you.
And then my last request is if you could send us some pictures for when we post on social media, like just pictures of you. And then to let us know one fun fact about you. So some funny ones you've gotten in the past is somebody has to have 3 hot sauces on whatever they eat. Somebody else like has a pink car, someone else. It's just really like weird things. Somebody else lives in a van. I don't know, just something silly like that.
Okay.
You can
I
let
sent you my headshot, I think, and then I'll DM you a fun fact.
yeah. Okay, thank you so much. We really appreciate
Thank
it.
you.
Problem. Take care, you too. Bye bye.